Welcome to the fifth webinar in the COVID-19 Ask the Experts webinar series. This webinar will address strategies for supporting teachers delivering remote instruction. I am Stacy Kalmaris-Skalski, and I am NASP's Director of Professional Policy and Practice, and I will be your moderator for this webinar. NASP has put together the Ask the Experts webinar series in order to support school psychologists as they navigate the pandemic and work their way towards remote service delivery. Each webinar is followed by an opening of a discussion thread on the NASP member exchange. If you are a NASP member, you will be able to participate in the discussion. If you are just a school psychologist and not a NASP member, you will still be able to access these webinars. Each webinar does basically three things. It addresses critical questions that are emerging as a result of moving our services to a virtual telehealth model. It provides advice and guidance from experts in the field, helps us understand the problems better so that we can then, thirdly, discuss those problems, share our strategies and our resources with one another. Today, we have four experts who will be offering their wise and sage advice to us. We have Ben Fernandez. Ben is a school psychologist who works for the Loudoun County Public Schools in Virginia. He's a lead school psychologist providing leadership to school psychologists and a broad array of psychological and school-based mental health services, including assessment, consultation, counseling, prevention, and intervention. He is a member of NASP's School Safety and Crisis Response Committee, and in 2012, he was named School Psychologist of the Year by the National Association of School Psychologists. Ben earned his specialist level training in school psychology at Bucknell University in Pennsylvania. Welcome, Ben. We also have Dr. Aaron Fischer with us today. Dr. Fischer is the D. Endowed Professor of School Psychology at the University of Utah. Aaron has been working with individuals with autism spectrum disorder and their families for 15 years. Specifically, his clinical interests concentrate on the assessment and treatment of children and adolescents with ASD and other disabilities, as well as providing support and training to their families. Dr. Fischer has written numerous research publications, including articles addressing the remote delivery of consultation services. Aaron completed his master's and doctoral degree in school psychology at Louisiana State University. Welcome, Aaron. We also have Dr. Nate Jones with us. Nate is currently a school psychology consultant at the Southeastern Regional Education Services Center in Bedford, New Hampshire. Nate obtained his Ph.D. in school psychology from the University of Connecticut in 2004, and he is a licensed psychologist and school psychologist in the state of New Hampshire. In 2018, Nate was named NASP School Psychologist of the Year. Nate is a member of NASP's Ethics and Professional Practices Committee, and he has served for 6 years as New Hampshire's delegate to NASP, and is now the past president of the New Hampshire Association of School Psychologists. Welcome, Nate. We also have Dr. Lisa Thomas. Lisa is the Associate Director of Educational Issues with the American Federation of Teachers. Dr. Thomas is a Special Education Policy Analyst and AFT Special Education Cadre Coordinator. She has a Master's in Special Education from Trinity University and a doctorate from the University of Pennsylvania, where she specialized in organizational leadership and minorities in special education in urban settings. She's the mom of 3 kids, including a child with physical, developmental, and behavioral special needs. Welcome to all of you, and thank you so much for joining us for this webinar. Okay, I think for our first question, let's direct this to Lisa Thomas, who is our good friend from American Federation of Teachers. Lisa, can you just tell us what teachers are working on right now in the face of this pandemic?
Sure. Teachers are all over the place right now. Some teachers are currently on spring break. Some are doing distance or remote learning instruction. Some are fully immersed and have been in planning and adapting lessons for the students that they support. We have other teachers who are doing some professional development, and some are doing consultation to help get things up and running in anticipation of working with the kids on their caseloads. In other places, we have teachers who are doing Zoom meetings with small groups of students, some ranging from 8 to 10 students per hour, some supporting maybe 1 or 2 students a day. It just depends. However, as you can imagine, it's all over the place with teachers supporting students across the country and in some of our Department of Defense schools, as well as the U.S. Virgin Islands and Guam. So as you can imagine, it's all over the place. And as you can imagine, also, we have teachers who are really struggling, trying to figure out how they will support our most involved students, students with healthcare needs, and students who are medically fragile.
It sounds like there's a lot of planning that's going on right now, too. Is that what you're feeling?
Oh, absolutely. Lots of planning and lots of uncertainty about what this will look like in a couple of weeks, a couple of months, and certainly when we transition back to what will be perceived as some degree of normalcy.
Yeah, it's a tough time for sure for everybody. So given that, what are some of the issues that teachers are dealing with that you think school psychologists might be most helpful with?
There are a couple of things. For many teachers, they're struggling with how to provide for the very basic needs of their students. AFT recently conducted an internal survey of our members, and as you can imagine, teachers were very concerned about some of the needs of students in terms of food security, meals, housing, healthcare needs. Access to technology. While remote learning was a default once the schools closed, access to devices and broadband and Wi-Fi was a big concern. Also, teachers need help trying to meet the mental health needs of the kids that they served and had to say goodbye to in a rather abrupt way. How should these teachers be talking to kids about the pandemic? What are the emotions that these children are facing? Many of our teachers need resources and a way to access school psychologists for this type of support. Teachers also need help in responding to the crises that the students are experiencing and how to help students navigate the many emotions that this pandemic is bringing. As you can imagine, a lot of these students came from homes that were in crises prior to the pandemic, and these situations did not change once the pandemic evolved into what it is as we know it today. Many of these children were in unsafe home conditions with domestic violence, child abuse and neglect, parental addiction. The opioid crisis did not go away with the advent of the pandemic. Poverty, homelessness, underemployment. Many of these issues are layered now with the pandemic. In addition, we now will have to address grief and loss as this will become more prevalent. And we will also have to address issues around losses in our community, both within the profession and students, and with teachers who've had to retire and take on different roles as spouses and friends and other situations are changing from day to day. So we will look to our school psychologists and other mental health professionals to help us address this. I think, I've spoken a lot about the loss of support, but we will also look to school psychologists to help us address the loss of support for kids, families, and teachers. Teachers are very communal, being able to walk across the hall or to have a coffee chat between breaks. And so that sense of community, it has been lost. Children are very communal, breaks and recess and, those bus rides. This is where children learn to play. This is where they learn to become functioning members of society. And so that sense of community and socialization has been lost. And so we really need to think about that loss of connectivity, and those behavior supports are now gone. And so we really will rely on school psychologists to help us navigate that.
That's excellent. I'm really just reminded so much about how this pandemic is just impacting our ability to really connect with one another. I mean, that's so prominent in what you're saying, and it has so many layers to it that have to be addressed. It's interesting because so much of what we're talking about are issues that kids experience every day in regular classrooms, and now they're experiencing it in their homes and in their communities at such a great degree without that support that they've always felt from their teachers. And I know that just, it's really ratcheting up the intensity and the needs so much more. So thank you for sharing about all of that. Okay, thank you, Lisa. I just am struck by how much this pandemic is really impacting all of our mental health needs and different types of things where we know our kids are struggling with and our teachers are struggling with and our families. And so I just appreciate all of your updating about that. So we've heard a lot about the teachers and the struggles and the need to connect their students to mental health supports. I'm going to start with Erin and just try and get a feel for what are some of the things that school psychologists can do in this world of telehealth to help teachers. And maybe if Erin could start and just tell us a little bit about telehealth generally, and then we'll hear from Ben and from Nate about some of the services.
Yeah, thank you so much. Telehealth can be a really kind of broad, confusing term, and especially it's been thrown around a lot recently. When I've looked at this term for the past about 8 or 9 years, I've found that telehealth is really the global term to describe all of this work that we're doing through technology. And when we think about what that means for our work as school psychologists, really there's a lot we can do under that umbrella of telehealth services. The first thing that comes to mind may be teletherapy. And so as school psychologists, we can provide direct service provision or group-based services through a teletherapy format. What's really important to know as I kind of go through some of these as well is that there's a lot to be talked about with each of these different areas of provision. So we could probably spend a webinar on each of them. Please get more information if you're interested as a school psychologist to practice in these various capacities that I mentioned. So beyond teletherapy, there's also this idea of teleassessment. And this is the one that I shy away from the most, just because I think it has the least amount of research, and we really need people to understand how we can be effective at assessing students in the same way we would in an in-person format. Another piece as school psychologists that fits under this umbrella is telesupervision. And really this is a big piece that I think many of us will have to consider in these next few weeks is the practicum students, the interns, the folks who are new to the field who maybe are much more nervous about this. And how do we support them through this process by using technology? And then last is this idea of teleconsultation, which I think really fits in well with the webinar today, where we're really talking about how do you indirectly support teachers, parents, other service providers to really impact students positively. And I think the exciting thing about teleconsultation during this time is we have a lot of opportunity.
That's a terrific overview. Thank you for that. I know that a lot of people have been struggling with the vocabulary, so it's nice to have some guidance around that too. Ben, can you tell us a little bit about what the telehealth services might look like in terms of at least maybe some systems applications too for districts?
Sure. I think as school psychologists, we really need to take a look at, what is already existing. What do our school buildings, our school districts already have in place? Taking a look at our MTSS and other systems to say, okay, how do we take that and not morph it, but just adapt it to meet the needs of what we're dealing with now. Those systems, those teams are still in existence, but just in a different place. And we still can utilize those systems, those teams to problem solve, to get in there and provide supports, not only for families, but for students and teachers as well. It's just taking a look and saying, okay, how do we make sure teachers can connect to psychologists? How can families connect to psychologists? How can we keep that flow going? And I think those are some of the things that each one of us as school psychologists, as leaders, as consultants in our schools really need to do, and not be so afraid of, okay, we're now remote. What do we do now? The things are still there. It's just adapting it to this kind of new world that we live in.
That's great. And Nate, can you tell us sort of in terms of teachers and how we support them, what would those services be? Like, what are some of the things that we can provide for teachers through this type of model?
Definitely, Stacey. And I think what Ben just said is really important. And people can really struggle to sometimes come up with a brand new ideas. And I think one of the really important messages is that the things we've provided to teachers all along are the things that we can still provide to them. And while school psychology practice can vary so widely around our country, there's really some core things that we have supported teachers with for years, and we can continue to support them with that just in this new way. So building routines, helping teachers manage connections, simple things like check in, check out, so teachers are able to keep connecting with their kids. And sometimes our job through the teleconsultation models Aaron was talking about can be going back and just reconnecting with teachers and really encouraging them to maintain what they've always done, use the systems that they already know, use tricks and tools, check in, check out, working with families, the MTSS supports they have, whatever the standard supports they have in the classroom are, and then our job can become helping them modify and adapt those to remote learning, but not necessarily introducing a brand new idea.
Great, that's excellent. That's excellent. So I'm going to ask this question to Aaron then. So Aaron, can you tell us a little bit about what some of the best strategies for remote consultation and collaboration with teachers might be?
Absolutely. When I think about doing this work with teachers or other providers at the school or even caregivers, I really like to orient myself to a tried and true method. And so since I began doing some of this work, I've always leaned on the Bergen and Cradwell 1990 kind of seminal behavioral consultation text, which has been updated through the years. But really looking at this from a problem-solving framework and how can we take stepwise procedures to ensure positive outcomes. So I'm going to briefly describe a little bit of this problem-solving teleconsultation framework. And if you're interested in learning a little bit more about it in the infographic we have available, there's some citations that you can follow to learn a little bit more about how this would actually play out in practice and some of the research that's occurred around it. So jumping into the model, step one on our top left, we're really focusing on building a relationship. Through this whole process of teleconsultation, if you can imagine as an in-person consultant, it is always hinged on how much the individual likes you and wants to interact with you. This becomes exponentially more important through this virtual setting because now we have to work even harder to get people's attention, to vie for their time, and to also engage with them. I can't shake someone's hand, not that I'd want to right now, but I can't do that. And I think that these limitations, we can problem solve through them, but we have to be thoughtful about how we engage through this modality. So I have some kind of conversation pieces I think you can focus on in this first step, things like clarifying roles and expectations, making sure your language is extremely approachable, it's not pedantic or jargony, asking and learning about cultural diversity and just differences that they may be experiencing in their own communities, like difficulty getting access to technology during these times. We need to make sure we are understanding the parameters and limitations and barriers that our constituents are experiencing. Step two would be identifying the problem. And through this process, once you've built that relationship, you're going to need to maintain it, but then you're going to switch gears and also talk about how you can figure out what the problem is. And so instead of going into too much detail now about one specific problem, I would use these strategies listed to really figure out what it is that we need to improve on, figure out what happens before the problem occurs, what happens after, what are contextual factors that maybe are influencing these things. And remember, during this time, there are a ton of contextual factors that are influencing. And let's start getting some data collection to figure this out. One that you may all think of is engagement right now. How do we get engagement? Well, we can ask students to post things. We can ask them to do a variety of different things. We need to empower teachers to start to collect that information in their day-to-day interactions with students. Then once we've collected all of this data through this process of talking and communicating with teachers and parents and other caregivers, we want to synthesize this information and figure out what is going to be our viable intervention to solve this problem. We take that information, we present it in a written format to our stakeholder who's going to deliver this intervention, and then we have them implement this intervention with fidelity. That's always going to be the goal, and we want to monitor that. If things are going great, that's fantastic. In step 5, we want to make sure that things continue to go on and maintain and potentially generalize. And if we need to make modifications because things aren't working, then we can move back to step 3 and problem solve these things again. So most importantly, if you referred to this process for whatever problem you have, you can have a fighting chance to get through it. But remember, it's all hinged on the communication relationship that you're building with the stakeholder that you're interacting with.
That is excellent. Thank you so much for that information. So let's see, now what are some of the most important topics that school psychs can be consulting with teachers right now? And I'm gonna see if maybe Nate and Ben can give me some guidance around this. What are some of those topics that you think would be most helpful? Let's start with Nate too.
Sure, and Stacy, I think that for us right now, where school psychologists can really spend, I think the bulk of our time is around the social emotional learning, mental health awareness, supporting the mental health needs of our students, of our staff in schools, and through our students helping them with their families, because there are a lot of families, a lot of kids, a lot of students who are very much struggling with mental health and behavior and all the pieces that come along with social emotional learning. So this is where we have to really, I think, dive deep into the SEL part of our job, and supporting teachers now around understanding warning signs kids might be in crisis and how do they get help, and not forgetting about working with our community partners, working with the working collaboration, that no one has to do this alone. Even though we're all at home by ourselves, we have the internet, right? We're not really alone, and we have to have that awareness and the strategies and the systems in place. And I work in New Hampshire, and we've seen really concerning news articles that reports the DCF in New Hampshire are down by 50%. And events haven't gone away, just reports have gone down. And that to me is a really terrifying thing. And so supporting teachers that we still are mandated reporters, we still have to do our job, but also at the same time, now teachers have cameras into lots of kids' homes. And that can be a scary thing too. What does that mean? So to me, all of those pieces, then we can't forget about still our core, like we said before, the MTSS work, the basic social emotional strategies we want to support with our kids. And it all comes back again to things like routines and connections. So that to me is one huge basket. A second basket really becomes getting the special education supports online. That now we're trying to reinvent how we provide special education and regular education too, of course, but trying to reach students with a whole variety of really unique learning needs. How can we do that well? And I think that, teachers are amazing. They've done amazing things. And the stuff Lisa talked about is so true. The teachers are working incredibly hard to meet the needs of all students. And this is one place where I really encourage school psychologists to actively reach out. Schools might not call you, teachers might not call you here to ask for help, but if you call them, they will undoubtedly have questions for you. So I think really supporting getting those special education services in place is another very important part of what we're doing now.
That's great. That's good to know. Ben, is there anything else you would add to what Nate offered?
Well, I think during this time, we're dealing with a lot of uncertainty. We're dealing with the potential for people getting very sick, and unfortunately, people are dying from this virus. So I think schools really need to take a look and prepare for those kind of events and think about their crisis responses. And it's kind of what we talked about earlier, that these systems, these programs haven't gone away. They're still there. So, prior to the shutdown, with your crisis intervention programs, taking a look at that and how are you going to implement that in this remote world? And I think, now more than ever, we really need to be collaborating not only with, our partners, our mental health partners within the school system, school counselors, social workers, but also outside, looking at, your community mental health, your outside providers, because, we're all, I've always said school safety is an all school responsibility. And I think in this remote world, school safety and crisis response is going to be an all community responsibility, because we're apart now. And so I think really looking at how schools communicate with their school communities about a death or an illness, making sure that, that there's verified information that the family approves of that can be shared to help bring down rumors, because there as we know, there's so many different rumors going on, and that will increase threat and anxiety perceptions. Working with your public information officer and your health department to communicate the facts are going to be important. Really taking a look at what your grief and loss resources are, and trying to determine what is the best way to deliver that information to families and caregivers, because really we want to emphasize hope, help, and strength at this point. We want to make sure that yes, we were going through this difficult time, but there are ways to get help and recover and be strong again. And so we want to make sure that those messages are getting out there as well. And again, making sure we take care of each other as crisis team members. The other thing to take a look at is the trauma that potentially is going on. I mean, from this whole thing with the virus and everything getting sick, and plus, all the things that potentially may be going on in homes. As Nate said, and other people have said that, we're mandated reporters. We may not be hearing these reports as frequently as we have in the past to quickly address, but these things are still going on. How can we, as school mental health professionals in the school, connect with our resources inside and outside the school to make sure that there is a safety net, so when we do get a report of a child who needs some help, that we can plug them into the right support quickly and as efficiently as we can. And I think those are the key things. I think one of the common threads I think we're all saying is that just because we're now virtual and remote doesn't mean that the pre-existing systems that we had don't exist anymore. They still do. It's just making sure we get them, adapted to this new world.
Yeah, I think your comments are spot on, and they connect so nicely with what Lisa was sharing earlier about just really how many kids are coming every day to schools under normal circumstances, having experienced traumatic types of interactions at home and in their communities, and how those things now are, still happening. They're still impacting those kids, and yet those kids don't have the chance to connect with those teachers that provide so much comfort and stability for kids. And so I'm just really appreciative of your comments, and everybody's about how important it is to keep those connections going and keep the collaboration and the consultation going with the teachers and that level of support, so that hopefully some of it can trickle down to the kids. So with that in mind, then, really, we have talked a lot about today about consultation and collaboration, and I thought I would ask Erin to just tell us, through your research and through a lot of what you've learned about this over the years, what are some of the most common barriers to collaboration that you see when it comes to remote delivery of services, and how can school psychologists avoid and overcome these obstacles?
Yeah, I really appreciate that question. I think that with this technology format, people are scared of technology if they're not like these proficient technology people and are doing VR headsets and all the contemporary stuff every day. And I think we have to be really sensitive to that and really empathic that a lot of people are learning in this process and that their stress levels are much higher than they usually are. And so when we come in and ask them to connect on this video conference platform, and they may be worried that they'll break it or that something will happen or they don't know how to connect, or that they may be dealing with things at home, because as teachers, they're also trying to manage their own children that are at home. So for me, I think this is a great lesson on just compassion and empathy. That's going to be the biggest barrier that we're going to see. And then technically to get through these things is just being the teacher. I mean, as school psychologists, we still have to teach everyone we're consulting with how to be comfortable with this technology, that they won't break anything, that we can still have a substantive face-to-face interaction that can get effective outcomes. But that's going to take time, and there is a learning curve. And so I think just being patient with people through that process. And then, of course, I think just echoing the communication piece that you all have said, if we're not in good communication with our stakeholders, we can try harder. And technology gives us multiple ways to connect with them through texting, email, through video conferencing. But we need to get even more creative, I think, as teleconsultants, and use things like social media more robustly. Think about what parents can actually use during this time, and digest. And for me, and when I think about scrolling through social media, it's a 10-second video with subtitles, and then I move on to the next thing. And so we need to really start thinking about more robust ways of connecting despite many of these barriers. And I think the list goes on, but those are the two that I think come to mind, or a few that come to mind right now.
That's great. That's terrific. Okay, we've heard about so many great things so far in this webinar. I think it's really important for us to now really concentrate on resources. So I'm going to ask Lisa if she could tell us specifically what resources do the American Federation of Teachers have that could really support the collaboration between school psychologists and teachers at this time.
So I'd like to draw your attention to sharemylesson.com. On sharemylesson.com, it is a remote learning community that is open to the public, and it is open to school psychologists and educators, family members, and students across the globe. Currently, we have over 1.7 million registered users. We have in excess of 30 to 40,000 members, individual new users each month. Anyone is allowed to become a partner with the caveat that any resources that you upload is free and available for use. Teachers, psychologists, and any person can upload a resource, whether it is a blog piece, anything that can be attributed to someone else. This is a great way to share lessons, information, resources, or ideas that others can access. We are hoping that school psychologists across the country will share resources on how family members, caregivers, and other students can exchange ideas on how to promote self-care for others, self-care for individuals, how teachers can promote ideas on how to navigate this pandemic and this new space at this time.
Wow, those are terrific resources. Thanks for sharing about that. So the key messages for the day really begin with, remember that teachers and educators, they are all over the place right now. Some of them are just starting their work. Some of them are well into the weeds and planning, and some of them have been underway delivering remote services for a couple days or a couple weeks. It is really important to remember that no matter where they are, no matter what they're doing, the same kids and their same needs are present. So keep your focus on the kids and try and do the best you can to support their teachers. Also remember that however you were working with teachers before, you can be doing the same type of things now. You don't have to reinvent the wheel, you just have to figure out how to adapt your services to a virtual environment. This isn't simple, but it's also not impossible. We can be working together with the teachers to support the kids in very similar ways as before. There will be things that will be easy to adapt, things that will be sort of easy, a little bit harder, and some that will just say, we just can't do it. And we just have to be open and honest with the teachers about what those things are and try and do the best, very best we can to connect services to kids, even if it's not us doing it. Finding somebody else in the community or in another school that can help the kids might be what we also have to do. So stitching together the services is going to be really important to make sure that we meet the kids' needs. Next, remember that school psychologists really need to reach out and listen to the teachers and discuss those student needs. Find out exactly what they are. They will have very similar needs to what they've had before, but the complexity of trying to do some of these things from their home might add additional things. So talk to the teachers and really say to them, what are you actually working on and how can I be helpful to you? This will go a long way in building that relationship with the teachers that really benefits the students. Please try and maintain daily connections with your teachers, check in with them, and listen to how they're coping, how they're handling the crisis, how they're exercising self-care in regards to them, their own mental health and well-being. Try and be a support to your colleagues, a good listening stone for them. Try and be that person that really helps them feel like they can be inspired to do this work too for kids. Take time and prepare for today and for tomorrow. Think about what's going on in these kids' lives and how the experiences that they were having before could be magnified right now. The trauma could be greater. The crises could be greater. How can you help these kids in those type of settings? What kinds of resources and supports can you help them access in the community and connect their families to? It's really important to remember that right now there are a whole bunch of kids who are in environments that are really stressful, not just for them, but also for their parents and for their caregivers. And we really need to do the best we can to listen for those needs and try and respond to those needs, remembering that when these kids come back to school, those needs will also continue and maybe in different ways. So make sure that whatever you are doing, that you're documenting your services and supports, and that even though you're operating in the present realities, you are also planning for the future. You're thinking about what compensatory strategies and extended school year services might be important to them. Try and openly communicate about the risks and the benefits of the services you're providing. None of us, not teachers, not school psychologists, not school social workers or counselors, spent a lot of time being trained in these remote service delivery platforms. We are all beginners in that regard, but we are not beginners as educators and as mental health professionals. We have to use the skills and the knowledge that we have and think about the new skills that we're gaining and how to bring these two things together. It is super important for us to recognize that we are all in this doing these new skills together, and that there may be some things that we do well, some things we have confidence with, and some things we're not so much. Make sure you openly communicate about the risks and the benefits of the services that you are providing or being asked to be provided in these really unique times. Lastly, when you really don't know something, you don't even know where to begin, seek out some professional development opportunities to enhance your skills and your levels of confidence. For some of us, we might take easily to some of these technological new platforms that we're interacting with, and for others, we might need to do a 2-hour training or a 2-day training. Our webinar series has links to various types of training that are available. We've also included those links in NASP and Brief, and we encourage you to seek out the professional development that you need in order to become confident and secure with these skills. If it's been a long time since you've done various types of direct service like counseling and direct interventions with kids, you might need to go onto the online learning center and pull up some professional development on there and really brush up on your skills. We've all had the basics of everything in our graduate training programs. Our jobs are the only thing that have limited our ability to do that over time. And now what we need to do is really think about how we can strengthen and support those skills and adapt them for the new realities and new environments. So do what you can. Our teachers are counting on us, our parents are counting on us, our principals are counting on us, but most of all, our kids are. NASP has a whole bunch of resources to support your work. Some are specific to the COVID-19 pandemic, and others are resources that we've had on our website for a long time. Everything on your screen is publicly available right now. It is there and designed for both home and school environments. And it can help you and help parents and help teachers navigate various types of mental health needs of kids. When it comes to the external resources that are on your screen, all of these were vetted by us, by our research department, and they have some utility to school psychology practice and to this application of virtual learning and education right now. We saw these resources as having some really valuable things that we thought would be helpful to you, and that's why we've included them here. Just as a note, we are not going to open up all of these links. We've intentionally attached them to your extra handouts so that you can go through these and navigate them yourselves and see what's in them and see what is most applicable to your settings. Because of the unique application of this telehealth experience in all of our schools, we just really felt like it was important to give you what we thought was the best and then allow you the opportunity to go dig through them. Again, remember that on the NAF member exchange, if you are a NAF member, you may now ask and post questions on the NAF member exchange community. We encourage you to direct your questions there. There are various NAF leaders and experts in our field who are following these discussions and who can help you navigate the way. We also encourage all of you who have good ideas to get out there and start sharing them. Do your best. Good luck with your work. Stay safe and stay healthy. Thank you to all of our presenters from today and to all of you who took the time to listen to this webinar. Good luck.